providing quality learning opportunities to all those who are interested in the subject of ENT on voluntary basis. We are starting with the study of larynx. We will be providing sets of multiple choice questions on various topics under the larynx. Each set of MCQs will be dedicated to a specific topic or subtopic and will be followed by a answers session in which all the answers will be discussed in detail. This will serve the dual purpose of both NEET and other competitive exams preparation as well as strengthening the clinical skills of the doctors. Last week we started with pre-training self-assessment questions. The answers key was not provided, so today we are going to discuss these MCQs after this initial introduction to larynx. Larynx performs three main functions. First is protection of tracheobronchial tree. This is the primary function of the larynx. Second function is participation as a respiratory passage and voice production. And finally, providing as an anchor to structures above and below the level of larynx. The protection of tracheobronchial tree is the primary function of the larynx. Some people have this misconception that it is the sound production. No, the primary function of the larynx is protection of tracheobronchial tree. This is performed with the help of a three-tier sphincteric system. On the top being the laryngeal inlet formed by epiglottis, arytenoid and thyroid cartilages and aryepiglottic folds. The second sphincter is formed by the false vocal cords. And finally, the third and the strongest sphincter is provided by the true vocal cords. The phonatory component of the larynx function has developed at the cost of its protective function. The larynx is formed by 9 different cartilages, of which epiglottis, thyroid cartilage and cricoid cartilage are unpaired, whereas arytenoid, corniculate and cuneiform cartilages are minor but paired cartilages. It is important to remember that cricoid cartilage, which is in the shape of a signet ring, is the only complete cartilage in the laryngotracheobronchial tree. Hyoid bone provides support to the larynx and the extralaryngeal muscles. There are a number of intrinsic and extrinsic muscles. The extrinsic muscles are both suprahyoid and infrahyoid. These extrinsic muscles stabilize the larynx during weightlifting, and the suprahyoid and infrahyoid groups of muscles, the suprahyoids elevate and infrahyoid muscles depress the larynx during swallowing. So the primary function of the extrinsic muscles is to stabilize the larynx during weightlifting and to lift the larynx or depress it during the swallowing process. The suprahyoid muscles elevate and infrahyoid muscles depress the larynx. Then there are intrinsic muscles which act to cause closure of the glottis and false cords as a part of the protection of the tracheobronchial tree and the voice production. The strongest sphincter is the glottis. The movements of the muscles cause adduction, abduction, tensing and relaxation of the intrinsic muscles. The cricothyroid is the only externally placed intrinsic muscle of the larynx. It is supplied by the external branch of the superior laryngeal nerve, and it is also known as Singer's muscle. It stretches and tenses the vocal ligaments. It stretches and tenses, and in part with the thyroid retinoid and lateral cricoretinoid, it takes part in adduction of the vocal cords. All other intrinsic muscles are supplied by the recurrent laryngeal nerve, which is a branch of the vagus nerve. We will talk about the recurrent laryngeal nerve as we discuss the MCQs today. The posterior cricoarytenoid muscle is the only abductor of the vocal cords. Then there are spaces of the larynx. There are two important spaces, pre-epiglottic and paraglottic. And then there is a Rynkes space, which is a mucosal entity. The pre-epiglottic and paraglottic spaces play an important role in the spread of malignancies in the larynx. The cartilages, the various membranes and ligaments, for example vocal ligament, they collectively contribute to pose a resistance to the spread of malignancies and confine them as much as possible. Embryologically, the larynx is divided into two distinct parts. The supraglottic larynx, that is above the level of true vocal cords, drains towards the base of the tongue, whereas the subglottis, below the level of vocal cords, it drains downwards to the pre-laryngeal and paratracheal lymph nodes. So this is in short the description to the introduction to the larynx. We will gradually. So now I will be quickly discussing the answers to the questions contained in the self-assessment exercise. The first MCQ was, which intrinsic laryngeal muscle is exclusively responsible for abducting the vocal cords? The answer is posterior cricoarytenoid. It is the sole abductor of the vocal cords. It is supplied by the branches from the recurrent laryngeal nerve, and it is also known as the Singer's muscle because it can alter the tone by stretching and relaxation. The second question was, the right recurrent laryngeal nerve loops around which structure? The answer is very simple, the right subclavian artery. Third question was, why is the left recurrent laryngeal nerve more prone to damage? So the answer is because of its proximity to the thoracic structures and longer course, it is more prone to injuries during surgery or otherwise. The fourth question was, damage to which portion of the vagus nerve can cause both sensory and motor deficits? The answer is superior laryngeal nerve. The superior laryngeal nerve splits into internal and external branches. The external branch supplies the cricothyroid muscle, and the internal branch gives sensory supply to the supraglottis. If there is damage to the superior laryngeal nerve, then patient can have anesthesia of the throat and come with a foreign body sensation or repeated desire to clear the throat. So that is the pointing towards the damage to the superior laryngeal nerve. The fifth question was, in bilateral vocal cord paralysis, which position are the vocal cords most commonly found? So they are in paramedian or median position. They are in close contact with each other, and during phonation there is a small breathing space. So if there is a unilateral damage, the patient can have hoarseness of voice which may go unnoticed, but if there is bilateral involvement, then patient can have respiratory distress and needs tracheostomy before he is shifted out of the operation theatre. Sixth question was, vocal fold injection material is the most common, which is the most commonly used vocal fold injection material for temporary medialization of the vocal cord which is paralyzed. So here the option B and C are correct. Hyaluronic acid and calcium hydroxyapatite are the two things. So the answer is B and C. And then we come to the seventh question. Injury to the vagus nerve can result in all of the following except. So if there is injury to the vagus nerve, there can be hoarseness of the voice, there can be dysphagia, and there can be hypotension. But the loss of gag reflex does not occur. So loss of gag reflex is not a sign of paralysis of the injury to the vagus nerve. The quadrangular membrane, as it is the eighth question, is an anatomical structure, and its presence it plays a role in preventing the spread of malignancies. So it poses a barrier. So the answer is, the statement is true. The next question was, pick the correct answer. So the statement was, paraglottic space is a bilateral structure. Yes, it is a bilateral structure. There is a right-sided paraglottic space, there is left-sided, and they both communicate with each other. Pyriform sinuses are separated from the paraglottic space only by a mucosal fold reflection. That is a correct statement. Paraglottic space is separated from the pyriform sinuses, which are there for the passage of the food, only by a thin mucosal fold. And this can be very easily involved, and the disease process can spread from the paraglottic space to the pyriform sinus, or from the pyriform sinus to the paraglottic space. The presence of tumor in paraglottic space makes it transglottic. That is the correct statement. If the disease involves one